with low vision, I always ask somebody, you know, what are you hoping to get out of this exam? And usually the answer is, I just want to see better, right? That's really cool, except that I can't make it like it was before. So I really want to know from you, what is the activity or task that you want to be able to do? Because then I know what to show, or what to teach you, or what to try. The other thing I encourage patients to do is to start thinking differently. When your vision was normal, you got one pair of glasses with a bifocal or a trifocal or progressive lens and took care of everything. With low vision, you kind of need a toolbox. So, you know, if you're doing carpentry, you wouldn't think that a flathead screwdriver would take care of all your needs. And with low vision, it's similar. So for far away looking, if you had to see a sign, we would look at telescopes. That could be something handheld, mounted in glasses, something that you wear when you're watching TV. For taking a quick look at something, maybe it's a small magnifier or a magnifier around your neck. But if you want to sit and read for a while, you care more about the wide field of view. Maybe it's something bigger and heavier, but you can use it when you're seated. Also, just a really good flashlight. One of the most beneficial things that we carry in our clinic, I call it a mobility flashlight, but it's a super bright flashlight that illuminates a large area and has adjustable brightness. So patients find that that helps when they go outside or try to find something in the basement or something like that. So again, accepting the fact that we might need multiple low vision aids, multiple things to get the different things done that need to be done. Here you go.
I just wanted to say too, I think highlighting on specific goals is so helpful. So, you know, instead of coming in and saying, I just want to see better, of course, but then, or I want to read better, that's a little bit more specific. But if you can say, I get the Lorraine Chronicle and I want to, here it is, this is what I want to see better, this is where I would like to hold it. Like having specific examples is so wonderful because then we know our goal, we know our endpoint, we know what. And then the other thing is, you know, you can read at your threshold, like, you know, if you're reading at your threshold, that's not enjoyable. That like takes the pleasure. You have to go reread things. You're maybe so we need to get you. So if that's your goal, sometimes we need to get a little bit below your goal. So you're not reading right at your like critical threshold for how small we're getting you maybe a little bit low. So it's nice and big and comfortable. And to get that, you at that critical threshold, again, sometimes it takes an electronic magnifier, sometimes it's going to take, but having that specific item is so beneficial. Or if it's besides reading, like if you like to crochet or you want to tie a fish hook, like bringing that into the exam is so helpful because then we can actually see what you're working with. I always tell patients also, like, I love when, even if you have a magnifier and it's not working, please bring that in. If it's like, I haven't used it in years or it just sits in a desk, I just want to see where you're coming from. It's really helpful.